In this video, we shall talk about foot drop. Is it an L5 radiculopathy or it is a common peroneal nerve lesion? Both L5 root lesion and a common peroneal nerve lesion can produce a foot drop, but a few bedside examination findings can help to distinguish between them. The first movement is a foot dorsiflexion, as both L5 root lesion and a common peroneal nerve lesion produces a weak foot dorsiflexion. The second movement is a big toe extension. Both L5 root and a common peroneal nerve lesion produces a weak big toe extension. The third movement is foot eversion. Although a common peroneal nerve lesion produces a remarkable weakness in foot eversion, an L5 root lesion also can cause a weak foot eversion. The fourth and the most important movement for distinction is foot inversion, which is weak in L5 root lesion. However, it tends to be spared in a common peroneal nerve lesion. And apart from foot movements, hip abduction tend to be weak in L5 root lesion. So to understand the difference in foot drop pattern between the two pathology, we have to understand the exact anatomy of the L5 root and the common peroneal nerve. The L5 root supply different muscles in the leg through different peripheral nerves. We have the tibialis anterior muscle responsible for foot extension, the extensor hallucis longus for big toe extension, also the peroneal muscles for foot eversion. The L5 roots also supply the tibialis posterior, which is responsible for foot inversion, and finally the gluteus medius muscles for hip abduction. In case of L5 root lesion, all these muscles will be affected. Now let's come to the common peroneal nerve. The L4, L5, together with the first three sacral roots, unite together to form the sciatic nerve. The sciatic nerve is considered as the biggest peripheral nerves in the body, and these nerves will divide into two major divisions. We have the common peroneal nerve, and also we have the tibial nerve. The common peroneal nerves innervates some of the muscles that is innervated by L5 roots. However, it spares the tibialis posterior for foot inversion and the gluteus medius for hip abduction. Now let's talk about the main causes of the two pathology. For L5 root lesions, we have lumbar disc herniation at the L4, L5 roots. Also, it could be a metastasis or infection like spinal epidural abscess. While the common peroneal or fibular nerve lesion can result from compression due to prolonged squatting or leg crossing, trauma like in fibular bone fracture or knee dislocation, and it could result from various medical conditions like diabetes and vasculitis.